Gaza's health ministry says the Israeli military has ordered hospitals in the north to move patients and equipment to southern Gaza. I'm joined now live by Dr. Ahmed Mokhallati, who is a plastic surgeon and previously worked at the Shifa Hospital in Gaza. And he's joining us now live from the United Kingdom. Doctor, thank you for joining us on the Al Jazeera News Hour. Let's begin first with your reaction to what the health ministry in Gaza has said, these comments that the Israeli military has ordered hospitals in the north to move their patients and their equipment to the south.
Thanks for having me. Let us just not be fooled by moving hospitals. These hospitals are not functioning hospitals. The service in the north of Gaza and Gaza is scattered between small hospitals, hardly managed to provide services between 10 hospitals, between NGOs and private hospitals in Gaza, especially after destroying the big hospitals, a Shifa Hospital with 700 bed capacity, and all the big hospitals, the governmental ones in the north. So we are talking about compromised services, about collapsed system, hardly survived these 2 years. And I would say, as an example, the ICU services was not there for more than 16 months in the north of Gaza. So it is, again, working on the morale of the people, scaring the people by these ethnic cleansing plans, pushing the people out of Gaza City, and mainly by preventing them from the basic right of having health services. Mm-hmm. So it is, again, part of the
You talked about a healthcare system in a state of disrepair, but of course it's worth alerting our audience and reminding them that the conditions of these patients, many of them, of course, have been suffering without adequate medication. Of course, healthcare workers trying their best to serve those patients. But what would it even be like, the feasibility of moving patients who are already in such a severe condition?
To start with, all the hospitals across Gaza Strip are more than 300% capacity in the beds. Patients are in the corridors outside the hospitals, in tents in the, I would say, the outside areas of the hospitals. So definitely this is not something feasible at all. There are not enough ambulances, no spaces in other hospitals, and all of the critical patients will never had space to be provided or cared for outside their hospitals, wherever they are. So imagine a service like dialysis, ICUs, neonates. Imagine moving all of these from the north and center of Gaza to the south in overwhelmed hospital, already overoccupied. So it's kind of killing these patients in the hospitals. There is nothing called evacuation. It can't happen at all. It's not feasible. And again, it's clearly killing everyone. But I would say the more important is they want the people in the north of Gaza and Gaza City to feel there is nothing secure in the place. There is no backup, because hospital is not health services only. It's a feeling that there is a place with a system where you can go around it. There is electricity there. There is some support in all aspects, some maybe support in the health system where the people in Gaza would feel they are secure.
And Doctor, you've talked about the impact that this would have on people in the north in terms of making them more fearful, making them afraid. But what would it mean for hospitals already overburdened in the south?
I would tell you from very close, opinion from the leaders of the health system, it is not feasible. It is something, I don't know, the reaction would be that we can't do this at all. And it was not only the Ministry of Health decision, it's also the the local organizations, the Palestinian Red Crescent said we can't do this. We are not something very difficult. It's a nightmare to the health system, the Ministry of Health in Gaza.
Right, thank you so much, Dr. Ahmed Mokhallati, who is a plastic surgeon, previously the head of plastic surgery at the Shifa Hospital in Gaza. Thank you so much, Doctor.
Thank you.
Well, as we mentioned, Israeli Prime Minister Benjamin Netanyahu says he has approved plans for the military to seize and take control of Gaza City. Netanyahu also says he has ordered immediate negotiations to secure the release of Israeli captives held in Gaza and to end the war under conditions acceptable to Israel. I'm joined now live by Hamdah Salhut, our correspondent, reporting from the Jordanian capital Amman, and a reminder that she's there because the Israeli government has banned Al Jazeera from operating inside Israel and in the occupied West Bank. Hamdah, talk us through what else Prime Minister Netanyahu had to say.
Well, the Israeli Prime Minister releasing a video statement saying that he has now approved the Israeli army's plans to conquer and occupy Gaza City. But in the same breath, he said that he also ordered for what he's calling the immediate negotiations for a ceasefire deal to release the Israeli captives and for an end to the war, but only if the conditions will please Israel. But there's still no word at this time of any sort of negotiating team heading to either the Qatari capital Doha or the Egyptian capital Cairo. But it's worth mentioning that last night Netanyahu released another statement saying that he wanted a shorter timeline for taking over this northern part of Gaza. The Israeli military doesn't exactly have a timeline of when they're going to go in, but you can know what they have said previously, which is that they are operating what they say is great strength and force in and around Gaza City, and that it's only a matter of time before they go in, forcibly displacing more than 1 million people in the process.
All right, thank you so much, Hamdah. That's our correspondent, Hamdah Salhut, reporting from Amman.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.